community resident post-graduation, and we promised that we did not plan this, but I did the exact same residency that Dr. Tran did. I was the first. So it's been great actually having a lot of Maryland students go to the VCU residency, just because it's a long history. I think we're up to 5 or 6 now, Dr. Tran, in terms of previous students that have gone on to residency with VCU. But to be honest, as a student, and I'm so glad that there are students on this call, because I can't tell you how many times I talk to a P4 and they're like, did we hear you say community residency? That's a thing? What is that? And it's the only reason why Dr. Tran and I came to Lou and NCPA to really talk about the fact that we should have this forum so students are more ready and prepared to know what this is. So anyway, I completed the community residency with UCrop's pharmacy, which is actually, again, similar type of setup to Dr. Tran. After I finished the residency there, I did move on to Maryland. But one of the main reasons why I went to Virginia at the time was because there wasn't a lot of patient going on in Maryland, at least from the standpoint of really having expanded scope of practice. So by just crossing the border, I was able to do immunizations. I was able to do point of care testing. I did things like bone mineral density testing for osteoporosis. Like I said, really learned about immunizations, and we weren't even able to do immunizations in Maryland until about 5 or 6 years later, after I completed the residency. So that was one of my major reasons for doing that. And when I came back here as faculty, I joined University of Maryland School of Pharmacy, and I was shared faculty with Neighbor Care Pharmacies. Sorry to my P3 students in the PIC class. I know you guys have heard this, but I was with Neighbor Care Pharmacies for 9 years and did their patient care program coordination. I set up MTM technician training, immunizations, point of care testing, health fair education up the wazoo, anywhere with everyone. And I did that for 9-10 years, and then moved on to complete more administrative work at the School of Pharmacy. My passion is still in community pharmacy. And the last thing that Dr. Tran mentioned is that we are both involved in Flip the Pharmacy, which is a CPSN, or I'm going to totally not be able to tell you what that is involved right now. Dr. Tran can probably say it. Community Pharmacy Enhanced Service Network. Ding ding for me, it's 7 o'clock. Can't remember that. But we're really excited to work on that, because we're working with the independent pharmacies to really push practice forward. And the whole premise is to get those practices to engage with their patients so we can document the work that we do, and then be able to demonstrate the worth that community pharmacists really bring to their patients. Thank you for having me. And last but not least, Dr. An.
Hi, everyone. Okay, so my name is Zoe An. I don't know why my name is showing up like that, and I don't know how to change it. But my name is Zoe An, and I'm a current community pharmacy resident at UMES at APhA Discount Drugs. I graduated this past May from the University of Maryland in Baltimore, so I know some of you, and I'm class of 2020. I chose community pharmacy because I've always had a passion for working with patients in the community, with counseling and helping them with their medications. I worked at CVS Pharmacy as an undergrad for 4 years, and then moved on to working for Safeway for 3 years during pharmacy school. And I noticed during my experience as a technician and as an intern that the trend in retail was less of just dispensing pharmacies and more implementation of patient care programs. So I realized the importance of additional training for pharmacists involved in patient care in the community. So currently I work at APhA Discount Drugs as part of my residency, which is an independent pharmacy that's pretty big here in the Eastern Shore. And what I specifically like about APhA Drugs is that there's so much opportunity to be involved in different areas of community pharmacy, including regular dispensing, compounding. We also do pill packs for assisted living facilities, coordinating and delivering home infusion medications, and also diabetes management programs that provide diabetes classes and one-on-one counseling and monitoring for patients on CGM. In addition, as part of my residency program, I also serve as faculty at UMES School of Pharmacy, and I'm part of the professional development committee for the faculty and staff. I teach in the professional development courses for the pharmacy school and a pharmacology course for the PA school this semester. One of the things I think Dr. Tran and Dr. Layson Wolf can speak more about is that many of the community pharmacy residencies are affiliated with universities, for those of you that are interested in academia. And I initially was not that interested in academia, but the more I closely work with the school at UMES and co-precepting at Apple Discount Drugs, I found that I really enjoyed teaching students. So it's a great way to get your foot in the door if that is of interest to you. But thank you. That's a quick summary of what I currently do, and we can go more in depth um, about what I do and opportunities in the community pharmacy residencies with the presentation and the Q&A today. Thank you.
Awesome, great. So I'm just going to do a quick presentation, and in between each slide, I'll pause briefly to see if our two other presenters have anything to add in addition to what I'll be speaking to. So hopefully this answers kind of some of the general questions that you guys have about community pharmacy, kind of what our movement in terms of clinical services, and then what is community pharmacy residency. So there's definitely a movement of community pharmacy towards more kind of ambulatory care clinical services. And one of the reasons is that there's a lot of need, right? So there's 45% of Americans have at least one chronic condition. There's potentially 30 million uninsured patients that are entering the healthcare system. So those uninsured patients may not have a primary care provider, may not have a system in place for them to be able to seek care. So potentially the only person they could talk to is a pharmacist when they are going in to get something over the counter, or at the grocery store and they're walking by a pharmacy. There's also a large number of Medicare patients that we have to take care of. And it's estimated that by 2025, there'll be a deficit of more than 50,000 primary care physicians. So that means that there's an additional amount of patients that need care, and there's not enough primary care providers to be able to give care. So that's also another reason why community pharmacists especially can help with this. And then in addition to that is being able to meet the needs in our rural communities, because sometimes that pharmacy could be the only person, the only healthcare provider in 25, 30, 50-mile radius in rural areas. So the aim that a lot of people talk about when they think about the healthcare system currently is being able to help improve access to care, improve quality of care, and to help contain costs. And that's something that community pharmacists through clinical services could help with. Okay.
Add something to that, Dr. Tran. Okay. So with regard to clinical services, I think I hear when I interact with students is I really do retail. I want to do clinical pharmacy, right? And I think one of the major aspects, and just back to that previous slide of what Dr. Tran showed you, and another one she's about to show you, I think truly where you have opportunity to do clinical work is in community. Patients are literally coming to you. Now, there are a lot of other settings where you're hearing, obviously, ambulatory care and inpatient. So I think that there are, you have to really frame it the way that you're thinking about it. And I know a lot of you are exposed to what is kind of like the very stereotypical type of community pharmacy experience where you just see them dispensing and not really engaging with patients. I'm going to turn off my camera real quick because I think my connection isn't going well. That if this is driven by wanting to be served for their patients. So I really urge you to think about how can I clinical practice into interaction with my patient. And so when we're thinking about clinical pharmacy, it is feasible in a community pharmacy that. And so you want to kind of expand your mind a little bit thinking about clinical pharmacy where that can be done.
Thank you, Dr. Layson-Wolf. Yes, I definitely would echo that. These first few slides is really about giving you guys an idea of that community pharmacists do a lot of clinical services, and we're moving towards doing a lot more clinical services. So in this slide, it's really kind of talking about that direction of pharmacy. So it's actually not too long ago where we were only dispensing, compounding, and labeling. And then we moved into what we call now clinical pharmacy, which includes counseling, being responsible for drug therapy. So I really feel like we are at that tipping point, especially right now with COVID, and we have a lot more things that pharmacists can do to help with public health and our patients. So we really are at that point where we are providing more and more services and really being seen in a different light. So here are just some examples of different clinical services that community pharmacists can offer. This includes point of care testing. So this could be point of care testing for chronic conditions such as like diabetes, cholesterol, but it could also be things like rapid test for different infections. So like think about like strep or HIV or hepatitis C. So you could also do different types of different point of care tests, and in that and along with those point of care tests, be able to make changes in medications if allowed, or prescribe medications again if allowed in that particular state. We also do medication therapy management, different immunizations, including travel health. So giving travel vaccines and potentially prescribing or recommending travel medications along with that. Medication sync, which is when you try to make all the medications filled at the same time. You could also do a pill box fill along with that to help patients with their adherence. Contraceptive prescribing, where pharmacists in a community pharmacy setting can actually screen, recommend, and then prescribe contraceptives for patients, and that's the case in Maryland. Smoking cessation prescribing, so many states across the country, sorry for the slide changes, many states are now, pharmacists are now able to do smoking cessation prescribing. Same thing with HIV PrEP prescribing, specialty medications, and then different wellness services. And I think this specifically is very unique to community pharmacy because you don't see ambulatory care pharmacists or hospital pharmacists going out to the community and providing wellness services or health fairs. So these kind of services are really specific and are done by our community pharmacists. See if either one of our speakers have anything to say for that one. Okay. All right, so then I'll move on and talk about the next slide. So what is Community Pharmacy Residency Program, also known as CPRP? And then why go into community pharmacy residency instead of going straight into working, which is a question I get a lot. So some of the benefits to doing community pharmacy residency is being able to really advance your training opportunities, especially because things I hear sometimes from students is that once they get into a job where they are, let's say, working in a community pharmacy, they don't get as much mentorship and guidance in terms of how to run the pharmacy, how to really feel confident in doing verification and providing clinical services that are available at that pharmacy. So you have the opportunity to get additional guidance, additional training to be able to give direct patient care. It's kind of like that bridge between rotations and then whatever practice you end up in. So you really get a chance to hone your patient care skills. You also get a chance to learn how to actually develop those patient care activities and those services that are provided at the pharmacy. That's one of the requirements of the community pharmacy residency. And hopefully by the end of the residency, you really are an advocate for community pharmacy and community pharmacy residency. And you become a leader, an innovator. You guys are the ones who really help drive the future of community pharmacy and developing those clinical services.
If I could add something there, maybe Dr. An can talk a little bit about her current experience, but I think the other piece to that is that when you're in a formal residency program, you're actually given the time to do these things. I think that when you're in there, just, I want to say just as working, but like if you enter in as an employee and you're not in a residency program, a lot of the times I find that pharmacists who want to do patient care sometimes have to kind of do it on their own time. Whereas a community residency, it really teaches you how to integrate the dispensing portion with the patient care and realize how those two things can work together. And you are given the time to do that. And like Dr. Tran said, you're given the mentorship on how to do that. A lot of these organizations are looking to train their future pharmacists, that a lot of them do stay with the organization so that they're able to really do these kind of services just in the workflow, and they're not trying to figure out how to make it work. Like, they've been given a year to really figure out that workflow so that they can, just hit the ground running with regard to the services that the community pharmacy wants to provide.
Yeah, I would definitely say that with the community pharmacy residency, they really do give you the time. Like, when I used to work in retail, I feel like a lot of the pharmacists kind of dreaded patient care programs because it felt like they were just piling it on top as like an additional work. But as a community pharmacy resident, it really separates you as like into a little niche where you are like the patient care pharmacist instead of just dispensing.
All right. So what are the components of a community pharmacy residency? So just like any other residency, you have patient care, you have research, and then you have teaching. But specifically in that patient care realm for a community pharmacy residency, you are at a community pharmacy longitudinally. And that might look different for different types of residencies. Some where you're only at one specific store, especially like if your residency is at an independent pharmacy, you may rotate between a few different stores. If, let's say, you're in a chain, grocery store chain. So it might look a little bit different, but overall, you're there at that community pharmacy site for the whole year. And at that site, you would provide services, so things like MTM, transitions of care, dispensing. You might also develop and enhance those services through a business plan. So you would develop a business plan and hopefully be able to actually implement that business plan as part of your residency program. Another really unique thing about the residency is being able to gain marketing, like additional skills. So things like how to market your services. I think that that's a really big thing because in a community pharmacy setting, you really have to think about how do you market to patients. It's still a business in the end, right? How do I get compensated? How do I get reimbursed for my services so it's worth the pharmacist's time? And also get a chance to really learn about how to become a pharmacy manager, so that management skills. In addition to the community pharmacy piece for patient care, you also have usually an ambulatory care component that might look like going to different ambulatory care clinics and rotating through different ones. So I'll pass it along to our other two presenters because I'm sure they have tons to say about that patient care piece for this component.
I think a lot of what drives the patient care, depending on the residency site, is obviously what's established. But another piece that can really drive that is maybe the state that you are practicing in has a lot of other capabilities. Dr. Tran mentioned earlier that some states have collaborative practice agreements. Some allow, we already allow contraceptive prescribing, things like that. So it really is a unique opportunity to be able to provide these types of services in the setting where patients are coming into the practice. And the patient care piece, I think, is so important. And I believe that maybe Dr. Tran maybe has a slide in moving forward, or maybe we had just covered one. But one of the biggest challenges that we have is having enough places where patient care is being done in a community pharmacy where it's visible to patients, visible to providers, visible to kind of like the community as a whole, not just the pharmacy, but the community as a whole, so that people can really come and see that the types of services that they can receive at a community pharmacy, especially in rural areas where resources may be really limited. And once we're really able to build that momentum, I really feel like that's when we're really going to be more successful at achieving things like a prescriber status, which is what you hear us talk about a lot. When I think about where prescriber status is really meaningful, it's in this exact setting. Just because there are so many community pharmacists that are more accessible by patients, if we can demonstrate just how much it is that we're able to do, we definitely become a lot more of a credible Not that we aren't already, but they can visibly see the different things that we do.
And another thing I wanted to add was that there is I feel like there's a misconception with that if you do a community pharmacy residency, you're kind of stuck in the community realm. However, with my residency program, they're actually very flexible with your interests. So for me, I have my practice site, which is APhA Discount Drugs, and there's so many different patient care opportunities there. But I expressed an interest in geriatrics, which is something that I was interested in since like undergrad. And they actually connected me with someone from UMES to be able to provide patient care to a nursing home facility, and where I'm doing patient care education virtually with the assistance of the nursing faculty there, since during this COVID period, I can't physically go. But we have like iPads where we use the iPads to do virtual patient education. So depending on your site, community pharmacy residency doesn't have to be so restrictive and like confined into one specific site. It can be very flexible. And that's just one misconception that I think that students should be more clear of and aware of.
Great points from both of the other presenters. And when you get a chance to get into the breakout rooms, you guys can definitely ask us more about what kind of patient care services we're actually providing when we get into those. Okay. So what are the different practice settings that you could do a community pharmacy residency? So you could have, you could do your residency in an independent pharmacy, in a supermarket or grocery store chain, a chain pharmacy, so think like CVS, Walgreens. You could be attached to a hospital setting where you have an outpatient pharmacy. And you can also have clinic pharmacies. So many different settings. And some of those things you want to think about is you can get different opportunities and different kind of experiences with these different settings. Some ways to think about it is, for instance, some of the great advantages of going to a residency with an independent pharmacy is really getting more of the opportunity to learn about that management piece. And being able to develop services with really a lot less red tape, right? You just have your boss, your residency director, and then you can develop those services. Versus in a supermarket chain or a chain pharmacy, you really have to think about from that higher level, where the cool thing is that once you're already developing that service is going to impact the entire chain, so that entire region, which is really cool, but you have more red tape, for instance. But then you get to learn more about district managers and kind of those kind of stuff. Another thing to think about in terms of practice settings is that setting established, so kind of what Dr. Layson-Wolf was talking a little bit earlier about is that residency site new or really traditional, has been there for many years. So both Dr. Layson-Wolf and I went to VCU, where the program has been around for, like, let's say 15, 20 years. So we get to learn about best practices, and we can really see what are some really great services that have been in place and how do we make a service look just like that. But on the other hand, if you go to a residency where it's their first year or second year of that residency program, then you guys are the creators. You guys get to develop those services, and you'll be the first ones. Like, you guys are the founders of it. So it's kind of really neat how you can really tailor your residency, and you can tailor your search for what kind of residency program you want to be involved in based upon the settings. I also want to say that there also are fellowships in community pharmacy. So I at least personally know of 5 fellowships, or PGY1/PGY2, community-based and administration leadership-based. So there are not just community pharmacy residencies, there are also fellowships.
I just wanted to add on to what Dr. Tran had said. I think there's a lot of customization that can be had. And even though this sounds maybe really super boring, but each residency program is supposed to have its own purpose statement, and either within the purpose statement or the mission of the residency program, you really get a sense of what kind of resident it is that they're trying to train. So it's not just based on the type of site, but it's also based on what is their like goal outcome for the resident that they want. And I think Dr. An had mentioned this before. You know, she talked about the customization. We have had some of our community residents out of Maryland go and do really interesting kind of work after they complete their residency, and then also really interesting PGY2s. So we've had a good number of our PGY2s go on to ambulatory care. And I've also had one resident move on to do a really interesting PGY2 in transitions of care. So it is a nice stepping stone. Most people think, well, what do I do after a PGY1 community residency? I think there's a lot of different opportunities there.
And that was a great segue into this particular slide about what could you do after residency. So not only could you potentially apply for a PGY2 in other areas, but if you wanted to go straight into practice, some of our residents have moved straight into a manager role. And this is because some people say, you know, doing a community pharmacy residency kind of equates to at least 3 years of being out in practice. So a lot of times they go into that manager role. You could also become a clinical coordinator, a part-time clinical coordinator where you do patient care services, and then a part-time where you are a staff pharmacist. You may also be asked to be a residency preceptor or residency coordinator right off the bat after your residency. And just like Dr. Layson-Walpo now, we became faculty members. And then I was just checking the time, sorry about that. So what the difference is between community pharmacy and ambulatory care. And I think that I could talk about this all day long, so I'm going to try my best to kind of condense this information. But one of the key things that I think of when I try to explain to students about the difference is the patient care population. So when I think about community pharmacy, I can help serve and screen for and talk to any patient that comes to my community pharmacy counter. Versus in an ambulatory care clinic, I am referred by those patients. So a physician or whatever has to refer those patients to me, or I may only see the patients in that particular setting. So I work, let's say, currently in a physician's office. So I only see patients that are part of that physician's practice. So you're kind of limited in the types of patients you get to see. And that kind of really drives part of that public health piece, is that community pharmacists are really helping to promote the wellness and the public health of our community. Another piece is the business model. Because we are ultimately a business, we have to be able to think about that marketing, how to make the money, more so than in an ambulatory care clinic where the money is shared, and it's really maybe more about helping with outcomes, health outcomes of the patient. And that last piece is dispensing. So of course, definitely in a community pharmacy residency, you would still have to dispense, right? Because dispensing is a key piece of a community pharmacy. And sometimes I would say, if you're really gung-ho about a community pharmacy residency, then you really have to, in a way, have to at least like dispensing, because it's such a key piece, right? It's a key role of community pharmacists. Even though we're really moving towards more clinical services, dispensing is still such an important piece and will be for at least a while longer. I also think that dispensing is like a really great way, because that's how we get to learn our patients. That's how we form relationships with our patients, right? They're coming in constantly because they had to pick up their medication. So that's kind of like the basis of how we develop rapport with our patients. So I think it's really key having that dispensing piece.
And I'll be honest, I know Dr. Tran knows this story, but when I started my residency program, I kind of had a different perspective with regard to dispensing. I'm like, I'm doing this because I don't want to dispense. But over time, I've really come to realize just how an important piece that both of the things come together. Your patients are going to come to you because you dispense medications to them, but they will keep coming back because of how you treat them and the service you're able to provide. And truly, I think the really successful community pharmacists are the ones that really can tie in patient care and dispensing together, where it becomes really seamless. And I think the community residency really gives you that time to see how that works and really refine that for when you're done with the program.
Awesome. So that ends our really short presentation, which turned out to be a little bit longer than I thought, but I'll pass it back on to Sean.
Thank you so much, Dr. Tran, and also Dr. Layson-Walpo, Dr. An. I think that was great to get to know some community residency, what they are offering. And thank you again for NCPA for collaborating together. And so today, I'm gonna break into 3 different rooms with 3 different panelists, and then you guys can talk more about it, what you guys want to ask. And we're gonna get back at 7:49, and then we can just take a real quick screenshot, because we have to make a record of for other new reports. So so I'll put you guys in the breakout rooms. Thank you.
Sean is a well-trained officer.
Okay. Open all rooms. Dr. Tran is there. Hello.
Hi, Sean.
Hey, you want to go to the breakout room?
I thought we were done.
No, we extended 10 more minutes because people really like it.
Oh.
Yeah. Do you want to go in or not?
Uh, yeah, I'll go back to the breakout room.
Okay, I'll put you in the breakout room. Okay. Hello? Hello? Hey, Bella. Bella? Hi guys. How was it? Was it all right? Did you get to talk to a lot of students? Okay. Thank you, Dr. An, by the way, coming right after the working today.
Yeah, no problem. It was tiring. I got a sunburn and can't believe I got a sunburn in the middle of October.
Oh no. But at least it's Wednesday night. It's almost over.
Yeah.
Yeah. And thank you, Dr. Tran, for all the presentation and the extended time without letting you know previously.
No problem.
Yeah. All right. I think people are coming back to the main lobby. Okay, great. So thank you everyone for joining tonight, and thank you again for NCPA for collaborating with APhA to make this happen. I'm really glad to get to know more about community residency, and hope you guys also got a lot of insights. And if you still have more questions, please, I'm sure the panelists will be happy to answer, outside of this meeting. So please do so. I'll just take a real quick screenshot of us because this will go into the annual report. So if you can turn on the camera for briefly, that'll be great. If not, that's fine too. All right, 1, 2. Hold on. Okay, I think people are turning on more cameras. So all right, I'll give 5 more seconds. All right, 5, 4, 3, 2, 1. Thank you. All righty. Have a good night, guys.
Thanks, everyone.
Thank you, everyone.
Thank you so much.
Thank you, guys. Thank you.
If you want to. I haven't
I want to say hi to Zoe.
been like
I'm sorry. Dr. An already left.